In the present day, we're wearing personal protective equipment a lot more than we used to. The face masks that you wear to go into any sort of restaurant, business, establishment, whatever, that is PPE. In the hospital, we use a lot of PPE, like gloves, gowns, face shields, also face masks, and there are proper ways to use and wear each piece of equipment, and there's a proper time to wear each of those as well. For example, you might use different equipment for a patient that has the flu versus coronavirus. A patient with the flu, you might wear gloves and a ear loop mask, which is the mask that you can get from pretty much anywhere, the surgical masks. But someone with COVID, we're wearing face shields, gowns, gloves, and N95s. You might also use different PPE when you're treating a patient with MRSA or VRE or ESBL, which are all different diseases and viruses. When putting on PPE, there is a proper technique for each. This is assuming we're not using a sterile field like you would in a surgery. I am a patient support assistant at Dublin Methodist Hospital. I'm a nurse's aide, and so I'm not typically using my PPE in a sterile field. Actually, I don't think I've ever used it in a sterile field. I will use it to go into a patient room, interact with someone, get their vitals, check their blood sugar, clean them up, which is the best part of my job. But for example, if you're wearing a mask, I don't have any here with me, so unfortunately I can't demonstrate, but if you're wearing an N95, you'll hold the mask up to your face and pull both strings over your head. Girls, you're gonna pull your hair out the back, and one of the strings is gonna rest right here, kind of in the nape of your neck, and the other one will be up here at the top of your head. And let's see, that'll actually be recycled. I'm not sure, I think we were throwing them away before COVID, but now we're recycling them and Battelle is cleaning all of them. For gowns, just put it on how you normally would. You'll put your arms in and you'll want to tie it around the back. We used to bring it around the front and tie it, but the proper technique is to tie it in the back only. And that actually will be thrown away. As long as it's a plastic gown or paper, whatever, those will be put in the trash. Face shields, those are pretty easily applied. You just have the little rim on your forehead right here and you pull the strap over to the back. Those we actually are cleaning with what we call purple wipes. I'm not exactly sure what is in the purple wipes or what they're made of. So those are cleaned and reused. And then with gloves, I thought I would have a pair for demonstration, but I do not. You'll put those on as normal, but when you're taking them off, you'll actually use, let's pretend this is my gloved hand and we're gonna remove this one. You'll take this one off by kind of peeling from the middle of your hand or however else you get it off. You just don't want to touch the inside cuff or your skin, obviously. You'll bundle it up in your gloved hand, take 2 fingers, and you'll slide it under this glove. And that's just to keep everything clean because the outside of your gloves is contaminated and you don't want to touch those. So after all your PPE is removed, whatever patient you came into contact or whatever you did, you'll want to wash your hands. That is the most important thing. That's what everybody is really hitting on the head these days, is to wash your hands because that is the best way to kill really most germs. So just some tips for washing your hands. You'll want to just run them under water. I know however you do it, if you get soap before or after you turn the water on, whichever, as long as you're using soap. And you'll want to make sure that you lather, and then you'll scrub for 20 seconds at least. You can sing Alphabet, Happy Birthday song, you can sing it a couple times. I think Happy Birthday, you sing it twice. And you'll want to remember to get your nails on the palms of your hands. And then you'll want to remember to also do the backs, and don't forget your thumbs. Everybody always forgets their thumbs. And you can go up on your wrist, you can go up pretty high on your arm. And then you'll want to rinse. Now don't turn the sink off until you've dried. Because if you clean your hands and then you touch the dirty sink handle, kind of pointless. So you'll want to grab a paper towel to turn off the sink. And hopefully the doors have some way that you can, I don't know, open it with your foot. But yeah, that's all. Just everybody pay attention to how you're wearing your masks. Whether you wear it or not, you got to wear it above your nose. That's just my bit of advice for the day. Make sure you wear your mask properly because otherwise there's no point wearing it at all. Thanks.